You guys to rotate on your own.
That's a lot to ask.
It is. Especially for some people. What would suggest child abuse in children? What kind of injuries? Rib fractures would probably suggest that you have more than just a fall, more than just the normal kid getting bruised.
Facial bruising.
Could be facial bruising, but remember, kids get injuries, so if they have rib fracture, that's a pretty significant injury. That takes a lot of force to have a rib fracture.
Like bruising around. Should I tell you?
Systemic means what? That if something causes systemic harm, it causes harm to the entire body. Okay? Do you always have symptoms with a concussion? No. Cardiac arrest. What does activated charcoal do?
Makes it develop.
How does it do that? You're right. It absorbs the chemical. Okay, so it binds to the chemical to keep your body from absorbing it. It binds to the charcoal.
Right, it's adsorbs, not absorbs.
It's AB, absorption, according to this test. But yeah, it should be absorption. A failure in the patient's compensatory response to blood loss. So what would you think would show a failure in our compensatory response to blood loss? You can talk this one out. What do you think?
Excessive blood loss.
What kind of signs are you going to see?
Low blood pressure.
See, that's what I would have thought too, and that is one of the answers, hypotension. However, it's not what they're looking for. I would say it's before you get to hypotension. Because what'd you say? They're saying tachycardia. Tachycardia to me is a sign of the following significant failure in the basic compensatory response. I would say that's part of compensation, is getting tachycardia.
What do you say? Oh, that's a stupid one.
Yeah, we might throw that one out. That's a pretty dumb question.
Just, that's the right answer. Hypotension.
Right.
Oh.
We'll probably throw that one out. Once again, delayed stress reactions on here. Knowing what causes delayed stress reaction. Knowing your different lifts. How to lift somebody off the ground. What that's called. If you're having a hard time gripping somebody that's in a chair, what kind of device could you put on them to help move them?
Kid.
You need to know what OPQRST stands for.
If you don't know that by now, you're probably
Yeah, if you don't know it, you're probably in bad shape. You know what tachycardia means? You know why we have quality improvement programs? You need to know what insulin does in the body. What insulin does in the body. You need to know how to take care of a patient that has been exposed to a toxic powder. How would you get it off of them?
brush it off.
And then, once you're done brushing it, flush with copious amounts of water. You need to know the law of inertia, Newton's laws. You need to know the difference between the meninges and the skull. You know what a contraindication to a medication is? This is no, dumb question. If we're on the scene, you guys seen this on an MDC? What do we? Have you ever seen us wear our helmets? No. Yeah. What do they look like? What are they?
Blue salad bowls.
So they're just construction helmets. It's all we need is EMS's construction helmets. We don't have to wear fire helmets or anything like that. We're just looking for construction helmets. Make sure you're handing them that AED. They don't start off with it.
Go back to one. Alright, please go on.
If you notice somebody leaning forward in what we would call a tripod position, you might suspect they're having what?
Difficulty breathing?
Also known as what?
Respiratory distress?
Oh, that's the appropriate medical term. So you need to know how to triage between 4 patients. If they give you 4 different scenarios on who is the most critical, would somebody with absent lung sounds on one side be most critical, or an unresponsive 9-year-old with an open skull fracture who's in cardiac arrest? Or remember, there's 30 patients, so you got to figure out who you want to send out first. Somebody who has an extremity injury who's awake, or a pregnant person with a cut on their head who's having some neck pain. Who do you think is most critical in that situation? Do what? No, because we're triaging. He's a black. Even though he's a kid, don't let it distract you. He's a black. We move on. We got 30 patients to deal with. He's dead. Sad. That's terrible. Do what? Collapsed lung, right? Absent lung sounds lead to death in a very short time frame. Okay? I feel like I say that over and over and over. It seems like it's important. Okay, think about, this is a tough question. If you have a bunch of hair on your body, bunch of hair, what happens? If you have a bunch of hair, you have a bunch of little ports for stuff to get in, right? So if you have a ton, if you're very hairy and you get a chemical on you, are you more likely to absorb it or less likely? You're more likely because you've got more little ports in your skin. Now if you shave, you're really likely because you've opened those ports. You know what index of suspicion means? Is providing counseling to patients part of your job? No. Being supportive is part of your job. Telling them how to live their life is not part of our job. Okay? You know what side effects of inhalers are? Need to know what another name for post-traumatic stress disorder is. You know what ventilation means, the medical definition. Should you ever lie to a patient? No. So tell them the truth. If it's going to hurt, say, this is probably going to hurt, but I'm going to do my best to make it not hurt.
You watching usually?
This is on recording, so anybody who's out of the room while I'm reviewing for the test can review it on the YouTube. You're welcome. You need to know causes of gynecological emergencies. I'm not very good at saying that. You need to know the stages of labor. Remember we talked about the stages of labor and what the ending of the third stage is and all that good stuff. You guys should already know that. Okay, so let's say you're on an MCI, critical incident. There's several sectors have been established. EMS, law enforcement, and rescue sectors are established. You discover that one of the passengers was carrying a suspicious package that's now leaking a white powdery substance. Who would you contact about this? Would you contact the incident commander, the EMS sector chief or officer, the rescue sector officer, or your dispatcher? What do you think? Think about chain of command. Who would you follow? You're part of what agency? EMS. So you'd go to your EMS officer who's overseeing you. The EMS officer would probably tell you you're stupid and that powder's powdered sugar, and he would never tell the incident commander, and then everybody dies. But the right answer is the EMS sector chief or officer. How big should our typical danger zone be for a typical car accident? To know how big our danger zone should be for a typical car accident, it should go about 50 feet in all directions. You need to know what wheezing sounds like, and you need to know where wheezing happens at. You know about crush injuries. You need to know what to do, and this was on your test tonight. If you're getting into a vehicle to help a patient that has been in an accident, you should do what before you get in? Disconnect the battery, wait 2 minutes. Those things can still go off. In fact, they say if your cell phone's plugged into the outlet on a charger, you should unplug the cell phone because there's enough power in here to backfeed into the car and make the airbags discharge. Did you know that? You should know that. With Paul, not Nathan.
Oh.
You on Warrensburg? No, you're just here, right?
Yeah.
Dylan's on Warrensburg. I can't keep it all straight. At least I know your name. You need to know what the palmar reflex is, the rooting reflex. And that's remember, the question doesn't say the patient has vomitus in the airway, and an answer says something about vomit being in the airway. Don't let it trick you, okay? So if it says, you're going to think, well, I need to do airway first because the airway, the answer says that to suction the vomit. Did the question say anything about suction the vomit? Probably not. So if you have an accident, what is the first thing you're going to do? You're going to maintain C-spine, right? Not suction an airway. Even though if the question said something about an airway, then you'd suction the airway first. But the question doesn't say anything about an airway. Who do you think is the main perpetrators of elder abuse? You need to know who the main perpetrators of elder abuse are. If somebody's hit in the back of their car, what kind of injuries do you think the people in that car are going to have?
Neck.
Probably neck injuries. Medical is in one of the 2 bedrooms downstairs, whichever one the door's open, either the first one or the third one. If a patient's anxious, tachycardic, and angry, and we think that they are on drugs, what kind of drugs do you think they'd be on? Do you think they're on marijuana? No, probably not. You think they're on GHB, date rape? Probably not. Because date rape, you'd be knocked out, right? Okay, makes sense? Do you think they're alcohol? Maybe, but probably not. Most people don't get crazy on alcohol. Maybe cocaine. I just want to throw something in here. Like wake you up. What do we use a traction split for?
A broken thing.
Broken femur, and it has to be where? Mid shaft, okay? Midway down.
I was waving at the internet.
Oh.
I wanted to be finished.
You feel fine to say?
When you're driving an ambulance responding to an emergency, you are required to do what? What are you required to do?
Be safe.
Follow the laws that govern us, right? Follow the laws. That is 200 question review.
Although, do read.
We've hit most of the concepts in those 200 questions. So there's going to be 3 videos posted.